as the Fertility Queen, offering hope to thousands of Aussie women struggling to conceive.
And Dr. Lynn Burmeister recently worked her baby magic on new mum Elise Toomey. Welcome to you, ladies. Dr. Burmeister, so you're sort of the baby whisperer, the miracle baby. Well, not really baby whisperer because it's pre-baby, isn't it? So you're sort of the womb whisperer. Okay, so tell us about this. What is your approach to fertility?
Well, my approach to fertility is analysing every little aspect of both patients, the male and the female part, and trying to adjust their treatment so that we come up with, you know, good eggs and good sperm and then hopefully a baby. So it's like creating a recipe in a way.
What do you mean, though? I mean, are you talking about diet? Are you talking about the surroundings? Are you talking about stress levels? Because all these things can be a factor as well.
We're talking about health, diet, you know, stopping smoking, alcohol, fixing up people's hormone problems, fixing up anatomical problems that maybe haven't been looked into in great detail, and then hopefully treating that patient and hopefully resulting in a pregnancy.
Elise, you were told by doctors that you'd have troubles conceiving and holding on to a pregnancy, weren't you?
Yes, many times by various different doctors, and that possibly it might be very difficult for me to conceive and also to carry to full term.
All right, so let's talk about Elise's case and Dr. Burmeister. So when you meet her, what did you think the issues were that she needed to overcome, if you don't mind revealing some of it?
Yeah, so Elise was referred from a colleague of mine, and Elise had had several miscarriages when I met her, and she had been told that her uterus could not hold a baby, and that's why she kept miscarrying. And she was told that her uterus couldn't be fixed surgically. And when I had a look at Elise in more detail, I said to her, I think we could probably fix the uterus so it can actually hold a baby. So Elise's uterus had a dent, sort of, it was like a love heart shape. And basically all I did was fix up the love heart and make it look into a normal uterus.
How did you fix the love heart?
Well,
not to get too graphic about it.
No. But it had her uterus had a septum in the middle, and so I just used a little knife and cut up the septum to the top of the uterus.
And so after the surgery, it was only, what, 12 weeks?
12 weeks,
and you're allowed
was basically just the healing time. So Lynn had just
try and get pregnant.
Yep.
And what happened?
Well, she actually booked me in.
This guy's what happened. Look at this guy.
The guy that happened.
That's quick though, because it was.
It was basically the first time.
Yep. My God, after all those miscarriages, you just must have been.
Yes, and I did just live in fear throughout the whole pregnancy.
I bet you did.
But fortunately, Lynn had me on very well monitored throughout the whole pregnancy, so I was high risk, but we got there.
And this has really changed everything for you. You know, all of a sudden, then you know, to be told, I think it's to be told no, you can't have a child, and then all of a sudden you meet somebody, and now. And I mean, the doctor is going to help. And now you have this amazingly handsome young man. Okay? He's a bit of a drooler, but he is amazingly handsome. That must make you feel like just like your whole life's turned around.
Totally and utterly. Yep, absolutely, for the best. He's just my little miracle, really.
And you always wanted to have a baby?
Yeah, and for me it was never an option not to have a baby, and I knew that it was going to be a little bit difficult, but I didn't realise how bad it was actually going to be. So finding Lynn was, you know, life-changing, obviously.
Lynn, you've helped thousands of women. Yes. Yeah. We think you're a little miracle.
I think we're right in saying thousands, Kate.
So you've helped thousands of women achieve their dream of becoming a mum. It just must be the most amazing feeling in the world.
It's a great job. I wake up every day and I love going to work, and I'm very passionate about what I do. So it's a fantastic job. I'm very, very
What's the hardest case you've... Sorry to interrupt. What's the hardest case you've had to work on?
Well, Elise was a pretty tough case because Elise also had an autoimmune problem which kept rejecting the pregnancy as well. So Elise was probably up there with one of my hardest cases.
And didn't I read that you went somewhere a bit special for the autoimmune problem?
I did. So after my first miscarriage, the amount of medication that I'd had was suspected to be one of the reasons why. So I went to the Dead Sea, to literally the lowest point on Earth, and I bathed in the Dead Sea for 28 nights. And cured the autoimmune, but I came back and continued to have miscarriages, which was clearly because of the deformity in my uterus.
Your double heart.
Your heart uterus. Now, there's your heart right there. You're holding your heart right now. Thank you for coming. Dr. Lynn, well, you are just astounding. Thank you so much for coming in and sharing it.
Having us.
I'm sure you're going to get a lot of bookings now.